From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and we are going to be talking about pain, or should I say pain relief this morning. Dr. Josiah Fitsimmons from Vero Neuropathy is joining us right now. Of course, he is board certified in neuropathy. Welcome back to the show, Dr. J.
Hey, Lou, thank you for having me.
Absolutely. Now, let's talk about getting rid of your pain. We said we're going to get people pain-free, and you have just to take it. Talk about the treatment process.
Absolutely. So what we want to do when someone first comes in is we want to do a very, very thorough initial evaluation for neuropathy. Typically, if you go to a medical doctor or your general practitioner, they're going to take a sharp stick, poke you 7 or 8 times on the bottom of your foot, tell you that you have neuropathy. We actually use 8 different unique tests to calculate down to the exact percentage of sensory loss someone has in their hands or their feet. We don't just come up with cookie cutter, one size fits all treatment plans or medications or drugs. We actually come up with corrective care plans for every individual patient to actually reverse neuropathy with no drugs and no injections.
Yeah, I like the sharp stick analogy. You know, you stick a sharp stick, poke around a little bit. Okay, yeah, you have neuropathy. That's not the way it's done, and you just told us why. But let's talk about the type of procedure that might be used to treat this, because you've got several, don't you?
Yeah, just like in the advancements we've done in testing and diagnosing neuropathy, there's also been significant advancements in actual treatments of neuropathy. Most people have been told there's nothing they can do about it, but that is not the case. We use low-level light therapy on the hands and feet to actually regenerate the arteries and restore the nerves. The entire treatment is FDA cleared, but it's so important to get evaluated as soon as possible because it's a progressive degenerative condition. It means it's just going to keep getting worse and worse. Once you get up over 80% nerve damage, typically you can't get 100% reversal. And so we encourage patients to come in, at least get that initial evaluation, see where you're at, because otherwise that's when people get confined to walkers, wheelchairs, and that's just something we never want to see happen. You want to get on top of it as soon as possible.
Now, let's be real clear here. If you watch TV at all, we are bombarded with ads for medications that can treat neuropathy. How about we just ask you directly, do these medications work first and foremost?
Great question. So the short answer is yes, they work to cover up the symptoms sometimes, all right? But no, they do not work to actually correct the problem. And that's what most people want. They don't want to just mask their symptoms, make them feel better for a few hours until they got to take another pill, you know, or another day. Then they got to go get another injection to just mask the symptoms. In fact, on top of that, you know, a lot of people are resorting to opioids, which we know there's a huge opioid crisis in America with addiction. And so what we want to do is we want to focus on actually regenerating the nerves, restoring the arteries that have actually died so we can reverse the condition, not just mask the symptoms. We have a great testimony of one of our patients named Dennis, who'd actually suffered with neuropathy for over 30 years and has been taking pain medications for so long, finally decided he wanted to get to the cause of it, came in, and he's a whole new man. You can watch his testimonial right here.
On TV, and I told them, I said, we need to call them and see if I can get in and see them. So, you know, if they can do anything to help me, because it wasn't getting any better. I'm taking medicine from the doctor to help relieve the pain, but that was not trying to cure it. So we got a call, got in, and come down and visit with the doctor, and he said he thought he could still help me. I was in 3rd stage, and he needed to do something pretty soon, or, you know, he couldn't do nothing. So we started, and I started feeling the difference in a week. I come 3 days a week first, and I do my therapy every day, light therapy and the water therapy. And boy, I could just tell the difference every week. It's just really impressed me. And it's such a feeling to feel your feet again after you can't feel them for so long.
Well, you want to have similar results. You have some seminars. Tell us about the seminars and what's all involved.
Yeah, Dennis, awesome testimonial there. Like I said, neuropathy for 30 years, hadn't felt his feet for over 20 years. He felt them for the first time in 6 weeks after coming. And so that's why we do these seminars, Lou, like you were just referencing, all around the metro. We do free educational seminars. We provide free lunch or dinner. And then what we want to do is we just want to educate people about neuropathy, what it is, what the treatment options are available, and answer everyone's questions, because so many people have been told there's nothing you can do about it. And that's just not the case. And so that is the whole purpose of us doing these seminars all around the metro, is to educate people, answer questions, give them hope of a better life.
Yeah, 335-VERO is the number, 515-335-VERO. There's lunchtime seminars, dinner time seminars. You get all the information and you get fed at the same time. Dr. J, thank you so much for all your information, and hopefully we'll have jam-packed seminars.
Absolutely, Lou. Thanks for having me. Like I said, give us a call. There's no reason to keep living in pain. We'd love to help.
All right, buddy. You take care of yourself, and we will be right back. This is Iowa Live.